Ariel, priorities for you over at Centers for Medicare and Medicaid Services.
Absolutely. So our number one priority from the experience perspective this year is measurement. And I want to get a little personal on that because when we talk about customer experience measurement or measurement in general, Mo alluded to this around, how do we move beyond compliance? How do we make this matter? How do we measure what matters? I'm just coming back from maternity leave. And so I have an almost 4-month-old, and I have the unbelievable opportunity of working at CMS at this point in time where just a couple of years ago, federal employees did not have paid leave to the extent that we do now. The Pump Act did not exist, but now it does. And so as an employee and executive at CMS, it is not lost on me what it means to see and notice these moments that matter in our lives as humans first, in our work lives, and make sure that we do not leave that at the door when we are writing policies, when we are implementing programs, and when we are interacting with each other and with the public. And while I was on maternity leave, it was very, very, frankly, surprising to me what the experience is in the US today of having a child in America. And I am not going to get on a soapbox on that topic at this moment in time. There will be a place and time, but I have way deeper appreciation and empathy for the focus that particularly we've had at CMS on improving the experience of having a child in the US, and also want to acknowledge one of our interagency life experiences where we are focused on birth of a child through age 5 in the US. To bring this back to the priority of measuring experience, in my own experience of going to many visits with providers, with care team members, cobbling together the most curated experience that I could possibly imagine as a designer at heart, I myself still struggled to figure out what information I needed and when, where I could get support. And I can only imagine what that is like for people who don't have my seat at the table at our organization and in government. And so to me, what customer experience measurement really means is we move beyond the thousands of surveys at every point in time. We move beyond the constant barrage of text messages and emails and phone calls and going into the office for every single visit when we may or may not live close enough to even make that feasible. And we take a step back, not only in our agency at CMS, but as a whole of government, and say, how do we make sure that we are driving towards having the best health outcomes in the world? Because we need to be the most aspirational organization and organizations in the country so that everybody else comes with us, and so that we keep up, especially with our partners in the private sector. One other thing I want to note here is, in terms of brass tacks, measurement can mean lots of things. So at CMS, we are focused in both the public-facing realm through our HISP. So we publicly report in the performance.gov arena on each of our high-impact services, as Mo mentioned. We are also, as I mentioned, at the department level, leaning into this agency priority goal. We are looking to translate as best as possible these moments that matter in the life experiences in a public-facing way through our employee experience as well. So what that means is there's an organizational health memo that all departments received, and the intent there is to also measure the experience of our organizations. And so CMS is saying it's not enough for us to, again, check a box. We need to be really living this. And my hope is that, as one of my former bosses said in the private sector, and it forever stuck with me, is there are many ways to measure these points and measure success. But once you get to a place where you're an organization like CMS and you have both the influence and the responsibility to the public and to your workforce, you need to pay attention to measuring success also by the stories we tell. Meaning it's not about stories of marketing, to be clear. This is the stories we tell to our children and to our grandchildren of what health can be like in this country.